the latest update on our respiratory virus outbreak here in Erie County. And I'm here with my friend and colleague, Dr. Steve Turkovich, who is the Chief Medical Officer at Women and Children's Hospital. So what we just want to report to you today is we're just confirming what we've already been very suspicious of for the past several weeks, is that the New York State Department of Health has been able to do a specific enterovirus D68 testing from specimens that were sent from the Women and Children's Hospital of Buffalo on children that were seen in the hospital, either in the emergency department or admitted, who were very ill with a respiratory infection. And we can confirm now that we do have enterovirus D68 in our community. So, and you know, the age ranges, actually the first positive test was from the middle of August, so this has been here for over a month's time. So, and again, our providers and our parents have been seeing in our community. So the message really hasn't changed, because we've always suspected all along that we've had this enterovirus D68 strain in our community. We've seen it in other parts of New York State, and it's been in other states across the country, including Ohio, our neighbor. So we've just assumed that it's been here in New York State, and so all we're doing is just confirming the messages that we've told you. So again, there is no vaccine to prevent this infection, and there is no antiviral medication to treat this infection. So, but we are able to take action to prevent infection and to prevent severe illness among our children. Again, we're specifically seeing severe illness in children. We're probably adults have this infection too, but for some reason they're not getting ill, and we just haven't been testing adults. But for what we can do, everybody, to prevent infection, this infection and all respiratory infections, is wash your hands as much as possible. This virus is pretty hardy. It's going to be, you know, surviving on people's hands after they blow their nose or you know, they wipe their mouth or their nose. It is going to be surviving on tabletops and doorknobs. So it's really important that you wash your hands as much as possible. Ideally, for at least 20 seconds, and then manually dry your hands with a towel to remove the virus from your hands. If you don't have access to soap and water, a hand sanitizer is the next best thing. Also, stay away from people that are sick. If somebody has a bad respiratory infection right now in community, there's a good chance that it's from this enterovirus D68 strain. So stay away from other people that are sick. Don't hug them, don't shake their hands, don't share food with them, stay away. And then if you or someone in your family is sick with a severe respiratory infection, remember, just keep them away from other people. Stay in bed, rest, drink plenty of fluids. And if parents see that they have children who develop a cold, and especially parents of children that have chronic lung disease like asthma, you have to keep a close eye on them. We know that this enterovirus D68 strain can cause severe illness pretty rapidly among children with chronic lung disease, especially asthma. And we know that this hits hard pretty quickly. So again, if parents have questions, if they think their child might be infected, if they're seeing their child might have some problems with breathing, you know, call your pediatric healthcare provider. That's a great source of information, because they probably need to be evaluated. Fortunately, we have not had any reported deaths from this virus in Erie County, all of New York State, and as far as we know, in the United States. But that's because parents are being very smart with washing hands, disinfecting countertops, staying away from other sick people. And our healthcare providers, namely Women and Children's Hospital of Buffalo and our pediatric provider community, has been working really, really hard seeing kids that are sick and admitting them to the hospital. They really need to be admitting and give them all the care that they really need. So our healthcare community is really working overtime to do as much as they can to keep our kids healthy through this. Fortunately, enterovirus typically is a seasonal virus. We see it typically in the summer and fall months. So we're hoping that we just have a couple more weeks of this, and then I'll be on to the next virus. But again, this is an atypical strain, so we'll have to see how it plays out. It might last a little bit longer. But again, this is a good drill to get us prepared for flu season, because that's coming up. We know that many pharmacies and adult providers have a good supply of flu vaccine. Many vaccine providers are offering flu clinics in the community, so it's a good time for adults to go out there and get immunized. It is not too early. Today is a perfect day to get immunized against the flu. For kids, many pediatric providers are just starting to get in their supply of flu vaccines, so that'll probably be in the next couple weeks, and stay tuned to your pediatric healthcare provider to see when they're offering their flu clinics and their flu shots, and take your kids in as soon as you can, get their flu vaccines. It is not too early. There's so many different choices of where to get a flu vaccine, what type of flu vaccines, that there's no reason not to get a vaccine. And for the first time, the Centers for Disease Control and Prevention has actually provided a recommendation, a preference for children between the ages of 2 and 8 years of age who are otherwise healthy, meaning they don't have a chronic illness like asthma or something else, that they should preferentially get the nasal spray, the live activated, the live inactivated virus vaccine, the nose spray, over the inactivated shot if possible. But again, if the most important thing is to get a flu vaccine, if you're young or if you're old, everybody should get a flu vaccine. And again, wash your hands. Are there any questions? Yes.
Do you have a number of confirmed cases?
We do have a number, but that's a moving target because we still have many pending tests that haven't been reported yet by the New York State Department of Health. So right now, in terms of Erie County, there's been 14 that have been positive, but again, we're going to see more test results come out later today from the New York State Department of Health, so that's really a moving target. It's going to change. And also, you have to remember that it was a select number of specimens from the Women and Children's Hospital that were sent for testing. So there are probably a lot of people out there that have the Enterovirus D68 strain who either never had this test or had a non-specific test for other respiratory pathogens or for Enterovirus in general. So the number doesn't really matter. The message is that we know this Enterovirus D68 strain is here in our community. We've confirmed what we've been suspicious for the past month, and we just have to take the appropriate actions. But the number really doesn't matter. It's just that we can confirm that the virus is here in Erie County.
Those tests that you're talking about now, say those 14 just for the heck of it, are those all from August?
They range from, I think August 16th was the earliest test until just the past couple weeks ago in September. So again, I think September 22nd was the last date of the test. So again, they've been, ranging in time, but again, it's dependent on, the specimens that have been sent from the Women and Children's Hospital Buffalo. But the message is that we know this virus has been here since the middle of August. We know it's still here. So again, we have to take the appropriate actions to protect ourselves.
On a scale from 1 to 10 to give us a little bit of perspective, just how contagious is this virus? There's, different levels of risk. If someone sneezes on you, you'll probably get infected. If you shake somebody's hand who has the infection and then you touch your face, there's, a good chance, probably 75% you'll get infected. So, it depends on what the contact is, what type of contact you had, and then, how susceptible you are. And there can be people that are infected, but they don't get very sick. We see a large spectrum of illness with this virus. It goes anywhere from, a mild cold that is, the person feels better a couple days later, to severe illness where a child needs admission to the intensive care unit and support breathing. So it's a huge variety. And this is a new strain for us. We haven't really seen it in this numbers before in Erie County, so we don't know a lot about it. This is our first, it's our first experience with it also. So, we'll have to see, and maybe next year we won't see it at all, and maybe it'll be the same outbreak as next year. We just don't know. We have no way to predict. This is, a relatively, new occurrence in our community.
I can say that the vast majority of children really have just cold symptoms. So many of them can recover, at home just as they do with any other cold. A small percentage of them do need to be admitted to the hospital. And of those that need to be admitted to the hospital, an even smaller percentage of those need the intensive care unit. The good news is the kids that are admitted to the hospital, both to the floors and to the ICU, turn around very quickly. So with some varying degrees of oxygen therapy, with the typical breathing treatments that you use for asthma, for children that do have asthma, they recover within 1 to 2 days on average. The most severe cases have been in the hospital for 3 to 4 days. So the take-home message is most children have a cold, and that's really it. There's no other significant symptoms associated with it. The children that I've particularly taken care of often will come in with a history of having cold symptoms for a couple days, and many of them have had asthma, and it's after those couple days that they start to have some problems with their asthma. So if your child does have asthma, the most important thing is to make sure you make contact with your pediatrician, make sure that they're continuing to take their medications on a daily basis as they should, per your pediatrician's recommendations. And if they do that, they should be keeping their lungs nice and healthy.
What are we doing to ensure that the schools stay clean and things like that? I'm sure,
We've been in contact, that's a great question. We've been in contact with all the school districts and, given them information about enterovirus that, until today we just suspected that it was in our community, and gave them information about, information they can report to parents about how to keep their kids healthy, and then information for them, again, about, keeping the classroom clean and having soap and water or hand sanitizer, on hand throughout all the classrooms and in the hallways. So again, we've been in communications with the schools, but the schools so far have not reported, overwhelming number of absences. So I think, again, most parents are smart, doing the right thing. Our healthcare providers are working hard to keep our kids healthy. And again, most kids develop a mild cold. It's only mostly children that have chronic lung disease like asthma who may get into trouble.
So if a kid has the cold symptoms, does it matter? Do they need to find out if they have the enterovirus, or do they just treat a cold and call it good?
Treat a cold just as you would any other cold. Fluids, rest. Most of these children will have a runny nose, a cough that can last for a while, sort of a wet-sounding cough. Very few of them actually develop fevers. So I think that's probably why a lot of kids aren't staying home from school, because they have mild cold symptoms. And so if we kept every child home from school that had a cold, we'd have pretty high absentee rates throughout the city through every winter. But you can treat it just like anything else, chicken soup, some tender loving care, and they'll do just fine.
So when it said it's more severe, is it the same as a severe flu symptom, or is it worse than that?
The children that are admitted now with this virus, comparing them to children that are admitted with the flu, tend to do much better. So this is something that seems to be pretty limited to the respiratory symptoms track. So it's really a cough, oxygen need type problem. Kids with the flu sometimes have fevers and can have other organs that are affected by that, generally feel miserable for a longer time with the muscle aches and things like that. So overall, I would say that this virus is more mild than the typical flu. It's just a lot of children are affected, so the volume is pretty high.
We reported back in the spring about a closing up on one of the floors here. Have you guys had any staffing issues because you have so many more of these cases coming in? Have you had to call extra people in?
It is all hands on deck. So we've opened up some areas of the hospital, some overflow units. We've engaged nurses, physicians, respiratory therapists, environmental service workers, registrars, everybody to come in and help with this peak of volume. I can say that in terms of the volume of patients we've had over the last few weeks, it appears that we're reaching a peak. Over the last week or so, we've had a pretty steady number of patients in our emergency department and our floors and on our ICU, but we haven't seen a dramatic increase from last week to this week. So my suspicion is that we are reaching a peak. It may last for another week or so, and just like any other virus, it should start to die out in the community. And as fall comes, we'll have visits from brand new viruses.
Do you have an estimate of number of people who've come in to be admitted for it?
I can say if you look at the typical daily census in the ICU, on average, at least half of those patients are there with respiratory problems. To say that all of them have this, we're not sure, but my suspicion is the vast majority of those children who do have respiratory symptoms probably do have this virus.
How many beds do you have in ICU?
We typically have a 20-bed ICU, and we've opened up an 8-bed overflow unit.
And has that caused you to bring in extra staff from other places, or is the current staff able to handle it?
Our staff here is outstanding. They are working overtime. They are working extra shifts. They are working really hard as a great team to accommodate the surge in patients. And this goes from the ICU all the way through the floors, through the emergency department. Everybody stepped up. You know, like I said, environmental services workers, nurses, respiratory therapists, physicians, nurse practitioners. We are managing this on a daily basis, multiple times a day, huddling with the senior leadership, with nursing leadership, with physician leadership to make sure that we have the appropriate staff at the appropriate time to manage all the patients.
Would you say dozens of kids have come in, or what would be kind of an estimate?
To give you a sense of the volume, this time of year we average about 11 or 12 patients in the ICU on a daily basis. Over the last couple of weeks we've been averaging 20 to 23 patients a day. So that kind of gives you a little snippet of the increased volume that we're seeing.
Just to be clear, are children the only ones at risk, or can anybody catch this?
Anybody really can catch this, and you know, like Dr. Burstein said, most adults, if they were to get this, will just get a mild cold, just like children. It seems to be the younger kids that seem to be most affected, especially the school-age kids. The younger school-age kids, the kindergarten through second, third grade, are very effective with sharing their germs, as we know. So they seem to be the ones that are the most affected.
Can you talk a little bit about how the testing is done in terms of why an August test shows up now? Do you send samples back, or what's the time frame of that?
So enterovirus in general is not a virus that typically affects just the respiratory system. It can cause all different sorts of things with different strains, but when we look for different respiratory viruses in kids, enterovirus is not typically one of them. So when we were alerted to this as a potential, looking at our partners across the country, we started doing an enterovirus culture on some of the samples we were getting from children's noses. And the culture can take 2 to 5 days to grow, and then once that grows, it's either a positive or negative enterovirus. It doesn't tell you the specific strain. Once that does grow, then we're sending that to the state, and then it can take a week or two for them to actually determine if this is the 68 strain. As we're learning about this virus, we've also discovered that the way that we culture it potentially needs to be a little bit different than we've cultured enteroviruses in the past in terms of using different temperatures. So our lab here has been in contact with labs in Albany and at the CDC to make sure that we have the optimal conditions to actually grow the virus. But by and large, the take-home message really is, by the time the test does come back, children are home and recovered and doing well. So it doesn't affect the management at all.
And then, as far as parents who are looking at, a typically healthy child who has a cold, when is the point where they decide, okay, it's cold symptoms, I'm okay, or it's something worse and I need to call the doctor? What are the things they should look for?
So the children that are getting admitted are ones that typically have difficulty breathing. So the things you want to look for are breathing fast in children that can talk. So that the younger kids that are in kindergarten and above that can speak in full sentences. When you start to notice that they can't speak in full sentences, that's a red flag. If they start looking like their ribs are sort of getting sucked in and they're breathing fast and working hard to breathe, those would be the symptoms that you want to have addressed immediately. And the kids that are getting admitted to the hospital have those symptoms. They respond very well to oxygen. If there's a wheezing component to it, so kids with asthma, if it does trigger a typical asthma attack, they are responding very well to the typical asthma treatments, things like albuterol.
But we think this whole uptick could be on the way down shortly.
Yeah, if you look at across the country, most children's hospitals that have managed this, from the early to midsummer through now, they looked at a 5 to 8 week period of beginning to end. So if we're sort of in that peak, we're looking at maybe another 3-4 weeks potentially. Every community is a little bit different. We have gone through the beginning of school, so that's the time when kids are sharing their germs the most, and that's when you're going to start to see the peak. So as the virus sort of runs through the community, you would expect that the kids are going to get sick, have gotten sick already, the virus starts to die out, and then eventually, within a few weeks, it should go away.
And Dr. Burstein, the last I saw from the CDC was that 22 states had cases in it. Do you know if that's changed at all?
That's the last that I've seen, but I have to look at the website. I haven't looked at it this morning.
I know that it is coast to coast, from California to New Jersey.
But again, it's this is also a function of doing the testing. So if you don't do a test, you won't have a positive test. So we know this is a problem in many parts of the United States, and as Dr. Turkovich said, is most kids present with a cold. It's children with chronic lung disease like asthma that so the younger kids that we particularly have to worry about.
Can you talk a little bit about the flu this year? How tough or not tough? What type of things we should be expecting to see?
We usually have a crystal ball of what happened in South America during their flu season, which was during our summer. And from what we've heard is that it hasn't really been an unusually, severe season for them in terms of flu. This year's flu vaccine does not have any new strains in it, although that doesn't mean that if you had a flu vaccine last year, you can forego getting the flu vaccine this year. The immunity wanes after a year, so it's really important that you get a flu vaccine every year, even if the strains are the same, because you won't have a good level of immunity from last year's vaccine. So I think we are going to expect probably what we saw similar to last year. But again, every year is different. If you remember, last year we had an uptick of influenza B like late in the spring, and so we had a prolonged flu season. And the year before that, we had an early flu season with many, many illnesses in January. So we never know for sure. So the best thing is to be prepared, get a flu vaccine, and then continue practicing the hand washing precautions and staying away from other sick people that people are hopefully practicing now.
Steve, would you say your name and spell it, please?
Sure, it's Dr. Stephen Turkovich, Stephen Turkovich. Okay, thank you, everybody.
Thanks.